The following Ask the Expert show is a paid advertisement program provided by Blair Ridge Dental, and airing of the program is not to be considered endorsement or recommendation. The opinions expressed are those of the host, guests, and callers, and not necessarily those of WMT or Clear Channel Media and Entertainment.
Well, good morning and welcome to Ask the Expert. I'm Jim Doyne. With me this morning from Blair Ridge Dental is Dr. Amy Wilken. Good morning. Good morning. How are you?
I'm great, Jim. How are you?
Well, we're doing just fine. Good to see you today. We're going to talk about Blair Ridge Dental and kind of the area that you like to work in. And everybody does it all, right, over at Blair Ridge Dental, but there are certain areas that you kind of specialize in, each of you?
Correct. I love doing cosmetics, so that's the area that I tend to specialize in more.
Well, I want to talk about that, of course, but first of all, I want to talk about Dr. Wilken, find out how long you've been with Blair Ridge Dental. You're a partner.
Correct, yep.
You and Dr. Joel?
Yeah, since 2011, I've been half owner with Dr. Joel.
What's different about being a partner? What's the responsibility? A lot of different responsibilities.
Definitely. Before I started at Blair Ridge Dental in 2002.
Mm-hmm.
So right out of school, and you see the advancements in technology and just how we do dentistry. And then in 2011, I became an owner, and you take on more of the business side of it.
Absolutely, so a lot to learn on that side too, isn't it?
Definitely.
What makes Blair Ridge Dental so special?
What's great about Blair Ridge Dental is just our technology. We don't just tell you you have something wrong with your teeth, like a cavity. We show you with our technology, with our cameras.
Talk about that a little further, though. What do you have that maybe some other dental offices may not have?
Well, we're able to make crowns in one day with our CEREC technology, and we've had that since 2002. When we first got that, we were one of 6 offices in Iowa, and now the technology has just exploded that there's many offices in Cedar Rapids, but we are always on the forefront of everything. We also have our 3D imaging, which is CT scans. So if you do have a problem that we can't identify with the 2D x-rays, we can look at our 3D imaging and try and figure it out.
That's almost instantaneous, too, so you can show the patient exactly what's going on.
Correct.
Is there a time where you try to save? When do you try to save the tooth, I guess, is a better question. And when do you feel, well, we either got to do a root canal or pull it?
Yeah, it depends on the bone loss around the tooth and how much structural strength the tooth actually has. Has a large hole in the tooth, and there's not a lot of tooth structure left. Sometimes it only makes sense to take it out and do an implant.
Of course, now implants are now the big thing, and they've been around a while, haven't they?
They have, correct.
But your office is now into that as well.
Correct, yes. The great thing about implants is it's titanium, so it's never going to decay. So it's a long-lasting result. So
you you take the titanium little post. Do you have to have a certain bone to be able to implant that titanium? Do you not?
Correct, and that's where our 3D imaging with the CT scans really helps, because we can see that bone mass and see where we're going to place that implant.
Well, what if somebody's come in and they've had a space there? You're in the cosmetic side. You want to help them out, make their smile much better, but you need to plan an implant, or you need to put one in, and maybe there isn't enough bone there to hold it. So what do you do now?
Yeah, sometimes you have to do some extensive bone grafting, and that's a diagnostic step that we can determine from the CT scan, but if there's a will, there's a way in dentistry.
So you can get that done. And of course you have bridges and dentures and all kinds of things that can help the people as well. On the partial dentures, they hook onto other teeth. Sometimes it kind of plays havoc with the teeth they're hooking onto, doesn't it?
Correct. And it can sometimes throw the bite off too, depending on how things shift to fill that space.
So what do you do then?
Well, we take diagnostic models of the teeth, we take pictures, and we kind of study, and we go through with the patient the advantages and disadvantages of each treatment options. But implant's definitely an option in something like that.
I would think so. Now, in a partial, for example, can you design a partial that will keep everything the way it should be as far as your bite is concerned?
Correct. Yes, you can. It takes a lot of steps to get all the procedure, and you got to kind of match the shade of the existing teeth. And there's a lot of different steps, but we do all those steps to make it as perfect as can be.
Dr. Amy Wilken is here. She's of Blair Ridge Dental, and she would be glad to answer any questions that you might have if you'd like to call her. 365-0600, 800-332-5401, *600 on your U.S. cellular phone. Give her a call if you have a dental question. Let's talk about you went into cosmetic dental as opposed to other areas that are available, but you do it all. Why cosmetics?
I just love to change the way people feel about themselves. It's amazing how if you change their smile, you either whiten it or get the teeth in the right position. It changes people's confidence and just the way they look at themselves. So.
And do people wait years to do this, or do you find that the younger people are coming in and saying, I don't want to go along this way for very long. I need to have some things changed so I can look much better. Job interviews, all kinds of things that you need to go to.
Yeah, that's an interesting point. I think the younger generation is more tuned into it. I don't know if that's just because of the Hollywood influence, with everything's whiter and brighter. But sometimes I do have people that have waited years, and then they just come in for a consult and, think about the options of what they can do.
Yeah, but if they wait years, then what? Then you got more problems than if you would have seen them 20 years ago or something.
Correct.
But it can be still straightened out. Is that right?
Correct. Yep.
Yep. Now, one of the questions I wanted to ask you too, when you go to whiten teeth, and we want to talk a little bit about the whitening of teeth, does that affect the enamel at all?
No, if it's done the way it's supposed to be done, as your dentist recommends, it shouldn't. It should have no effect on the enamel. It's just an oxygenation process. So you're taking a hydrogen peroxide or a carbamide peroxide, and it's kind of blasting that stain off the teeth. So
what affects your enamel? In other words, what is going to make your teeth look a little bit worn or colored or something like that you need to straighten out?
Right. It depends on the type of foods you eat. If you're drinking a lot of coffee, red wine, all that can have an effect on the staining of the teeth.
And that will also affect the enamel?
Well, it doesn't affect the enamel. It just if your enamel's very porous, then it will stain it more heavily. That's
why you should get in every 6 months and get those teeth cleaned and checked, right?
Exactly.
So, and then you come on the scene and you take a look and you say, we could do some things here to make you look even better. Is that right?
Correct. Yes. I mean, something as simple as we do Invisalign therapy too, where you just wear a clear mouth guard. It kind of pushes one tooth back to where it needs to be, and that takes care of it. And it's 10 weeks sometimes. I mean, something as simple as just wearing a clear plastic tray can change somebody's aesthetic appearance tremendously.
Now, you've helped some beauty pageant people, is that right?
Correct,
and
yes.
the people who have come in, and all of a sudden they decide, if I'm going to compete, I need to be smiling well. Is that right?
Yes, and they're always motivated to win that Best Smile award at the pageant, and so it's fun. It's definitely exciting to be a part of that.
Well, Blair Ridge Dental is actually located in Hiawatha, but you can see Cedar Rapids right across the street. Is that
right? True.
So let's talk about that, how they can make an appointment. You are taking new patients, is that correct?
Yep, always taking new patients.
And you have how many dentists over there?
We have 5 dentists.
Oh, boy, that's a good... And each one, when you come over to Blair Ridge Dental, the nice thing about it is you're in an individual location. You're not sitting out in a room that has, 5 or 6 other people at the same... You have privacy, don't you?
Correct, yes. Everyone has their own individual patient rooms.
That's right. So now, if they would like to make an appointment to have their teeth checked or cleaned, or maybe they even have they could have a tooth decaying and giving them some pain, don't put up with that, right?
That's right. And our phone number is 319-396-3596.
All right, what that number again?
319-396-3596.
And that's right here in actually Hiawatha, but it's Cedar Rapids because you're right on Blair's Ferry Road.
Right.
Very good. Right at the Shara driveway with Mercy Care North.
That's correct.
Okay. All right. Dr. Amy Wilken is with me this morning. We're going to take a quick break and come back and talk more with her. And you're listening to Ask the Expert on 600 WMT. Welcome back to Ask the Expert. I'm Jim Doyne, along with Dr. Amy Wilken. I had a question. On these stars that you see on TV, can you tell if they're having their teeth capped?
Definitely.
And when you look at them, you say, aha, they just went in and had everything capped, right?
Yeah. One of my favorite things to do is go through People magazine, because you can always see something. And it's after my cosmetic dentistry training, I can see things that I didn't see 10 years ago with the stars.
I'm sure you can. So this is something that, now everybody ought to have their teeth capped or veneered because they will look much better, right?
Not so much. That's not always the case.
Oh, okay.
So sometimes just bleaching will
bring it out
Yeah,
there.
we'll bring
Now
it
that's
out.
assuming everything's straight and everything's perfect, and we're not having to
Exactly.
move a tooth or something or in your mouth. Braces? Do you put braces on people for cosmetic purposes in order to get teeth to straighten out even after they're a certain age?
Definitely. No age limits on braces. That's the best way to do cosmetic dentistry, just because you're not taking anything away from the tooth. You're just moving them to where they need to be.
Now, if somebody comes into you and says, I just don't like my smile for this purpose or that purpose, and I'm sure you've heard this many times, I don't like the way they are sitting, how do you go ahead and work on this to make everything the way they want them to be?
Yeah, our first step is we take a series of photographs. So we take pictures of every angle of their teeth. And then we take models of their teeth too. And then I do a diagnostic workup. I get the patient back and we talk about all the options, whether it be braces, veneers. Sometimes it's just reshaping the teeth a little bit and adding some tooth-colored material.
What is the main complaint when people come in and ask? Is there one that kind of stands out in your mind that says, I just don't think I smile, and it's just the way I would like it to be?
Usually it's just one tooth that is just tipped or rotated a little bit that is so easy to fix now.
Really?
Yeah. A lot of times it's just one or two teeth that are shifted, and with Invisalign, which is basically a clear mouth guard, you can change that almost instantly.
Now, when you say you shifted, if you're turning or maneuvering that tooth, is that kind of dislodging it at all?
No, because you do it over a series of, a lot of times it's 10 to 20 weeks, so it can be relatively quick, and that doesn't affect the prognosis or the mobility of the tooth.
Well, what are the benefits then of cosmetic dentistry? What do you think are the main highlights in that area?
One thing that people don't realize is if you get the teeth in the right position, then the gum tissue is going to be healthier too. If a tooth is rotated, a lot of times the gum tissue is going to be more bulbous in that area. It's going to collect plaque more easily, and it's going to sometimes even increase your chances for food impaction or cavities in that area. So sometimes just getting the teeth in the right position really help the health of your overall mouth.
Now, you don't always cap or use a veneer, do you?
No, not always. A lot of times, if you can just reshape the tooth and add some tooth-colored material, you can be relatively conservative.
I didn't realize you could actually take a tooth that maybe it crossed over one or rotated a little bit behind something, and you could bring that back to be straight and in line with the other teeth. Is that right?
Correct. And
you say that's not too difficult.
That's not a big deal at all.
So don't put it off. See Amy, right?
Exactly.
All right. Now, if you have veneers or if you have caps on your teeth, will you still get cavities?
As long as you're flossing and taking care of your teeth, you're not going to get decay on the area that's covered with porcelain, but you have to still take care of your teeth because you can get decay underneath them.
So how do you recommend, whether it's a veneer or a cap, where do you go with that? When you take a look at the tooth, what do you recommend, and what encourages you to recommend one or the other?
Great question. So a crown, we usually recommend a crown if that's something that covers the whole surface, 360 degrees of the tooth. So we recommend a crown if you had a big cavity or if you have multiple fractures in the tooth. We have to cover the whole surface, whereas veneers are more for the cosmetic appeal. We do that just on the face of the tooth. So it's kind of like almost like a contact lens over the tooth. It's very thin, but it just changes the appearance.
How long does a veneer or a cap last?
Generally, it can last a long time. I know at our office, we stand behind it for 5 years as long as you come in every 6 months. But generally, we want it to last a lot longer than that.
Is that either a cap or a veneer, both of them in that
Correct. It honestly is how you take care of your teeth. If you're using your teeth as tools or biting things off with them, they're not going to last as long. If you're not brushing and flossing, then the chances of getting cavities underneath them are higher too.
Let's talk about the whitening of your teeth. Now, there's probably several methods you can use in order to get your teeth as white as possible. There used to be a toothpaste out called Control. Do you remember that at all?
I don't, but I know they're all, yeah.
And there was kind of a powder, and you put it on, you brushed it on your teeth, and that was supposed to whiten your teeth. I don't think it did, but anyway, in my opinion. But
Right.
But is there brushes or toothpaste you can go out and use, or is it better off to see you and kind of take on a bit of a whitening project?
Right, great question. A lot of times our whitening toothpaste, why they're whitening toothpaste is just based off the abrasives that are in them. So if you have some stain, the abrasives is going to scrub that off, but it's not something that it's actually bleaching your teeth with the carbamide peroxide that we have in our bleaching gels. So it's more focused on the abrasives.
And this abrasive, that's not going to damage the enamel in any way, is it, or could it?
It could if you don't brush properly. So if you are using a horizontal technique and really using that toothbrush aggressively with a strong whitening toothpaste, you got to make sure you're not overly contacting that tooth.
Well, the whitening process, if you cap some teeth or put veneers on some or the other, how does it affect all of this as you're working with the teeth?
Good question again. I mean, we always, when we do the veneers and we try to match the existing tooth structure, we always have a vision of what the patient wants in terms of what their final goal is for their shade. And then we work with that shade based off their natural tooth structure too.
So some folks want to change the shade completely?
Definitely.
Really?
Definitely.
I would suppose it would be to a more whitening effect.
Definitely. I mean, a lot of times, a lot of my patients want to go 7 to 8 shades lighter. I mean, it's
Really?
not uncommon.
And you can do that. You can get it there, huh?
We can, depending on where we start with.
Interesting.
Yeah.
So 7 or 8 shades. My golly, that's a long ways, isn't it?
It is. Typically, with the beauty pageants, those contestants, we're only doing a 1 or 2 to 3 shade difference. But there are some people that, it's a huge difference.
And you can do that. Dr. Amy Wilken is with me. Blair Ridge Dental. Let's talk again about Blair Ridge Dental before we have to leave everybody. But it's 5 dentists.
Correct.
And you invite everyone. You are taking new patients?
Always taking new patients. And we're located on 1700 Blairs Ferry Road. And our phone number is 319-396-3596.
Now, you folks, we haven't talked much about this, but you do emergency services as well. So, you come a patient of Blair Ridge Dental, you're going to help out right away, aren't you?
Definitely.
It's interesting how some of these emergencies take place either on the weekend or at night.
Yes. And we want to be there for our patients. To help them.
Absolutely. Dr. Amy Wilken, thank you so much for being with us today. And have a great day. And tell everybody at Blair Ridge I said hi. Will you do that?
I will. Thank you, Jim.
Thank you now.
The preceding Ask the Expert infomercial program has been a paid presentation brought to you by Blair Ridge Dental.